but first I'm going to hit record. Oh, thank you. So I'd like to introduce our speaker for our DigitalU Connecting Washington Libraries webinar series. Today we are very pleased to have Gail Kwame here. She is joining us from the National Network of Libraries and located, I know I butchered that, located at the University of Washington because it's part of the Pacific Northwest region. Gail's done many trainings for us, and this is a brand new one called The Medical Librarian is In, about accessing and finding quality health information online. So with that, I'll let Gail tell you more about herself, and please welcome Gail.
Thanks, Jennifer. It's my pleasure to be with you folks this morning, and I know this is also being recorded, so other folks can access this later who weren't able to be with us today. As Jennifer said, I am based at the University of Washington in the Health Sciences Library here. I'm a medical librarian by trade. My areas of specialty are consumer health and public health. The name of our office is officially the National Network of Libraries of Medicine, Pacific Northwest Region. We're also affectionately known as the Regional Medical Library. And we serve 5 states out of our office, representing the National Library of Medicine. So we work with Alaska, Idaho, Montana, Oregon, and Washington. So we do a lot of outreach in the Pacific Northwest and trainings and presentations, and you'll often see us in exhibit halls. You'll see me at the WLA conference in Wenatchee this year in the exhibit hall, and I'm also offering a pre-conference session with some librarians from Spokane County about the Affordable Care Act. And we also do some funding out of our office for health information outreach activities throughout the Pacific Northwest. Oops, I need to click on the arrow here. We're one of 8 offices around the United States that is funded by a contract with the National Library of Medicine. And if you don't know, the National Library of Medicine is part of the National Institutes of Health back in Bethesda, Maryland. So it sits on the same campus as all the other big research institutes that you often hear about in the news and whatnot that are doing research out there. And NIH has its own library to support the researchers, and the National Library of Medicine is kind of America's medical library, for lack of a better way of putting it. So a little bit about what we're going to go through this morning. I know I have you until 10 o'clock, and I want to leave some room for questions at the end, but also feel free to type chat questions in the chat box during the presentation if you want. I'm very open to having people chime in with questions or comments, and as Jennifer mentioned earlier, you can also just speak up by clicking the talk button if you have a microphone with a headset that you can use on your computer. So we're going to talk a little bit about why we're doing this. We're going to cover the concept of health literacy. What is it and why is it important? Why should we go to the internet for health information? I'm going to demonstrate 2 websites that are sponsored by the National Library of Medicine, but also point you to another resource of top 100 consumer health websites that you can refer to as well. And then we're going to talk a little bit about, once I've accessed this information, then what do I do with it, including helping people know how to best interact with a healthcare professional. So our goal for our session is to understand why it's important for people to be health literate, to help you be more confident in answering health-related questions. I've substituted at public libraries in the past. I know that the health and medical questions are nerve-wracking, and there's reasons for that we'll talk about in a couple minutes. So I want to help you feel a little more confident by the end of the session about answering health questions and help you become familiar with some trusted resources that you can use in your work. So, like I say, medical information can be a little scary for folks who aren't familiar with it. Part of that is because medicine speaks its own language and the medical terminology sounds very technical and complicated. There is a tutorial linked from MedlinePlus, the website we're going to look at in a few minutes, about understanding medical words, and it talks about how to break medical terms into pieces so that you can understand them better. And once you have a better idea about that, it becomes a little less daunting. Most medical terms are either based on Latin or Greek, and once you understand that the suffix itis means swelling, then you understand that appendicitis is a swollen appendix, and dermatitis means you have swelling in your skin. So it's pretty easy to start deciphering those terms once you have just even a basic knowledge of that kind of information. But of course, health information is also emotional for people. Oftentimes somebody's dealing with a new diagnosis, either for themselves or a family member, and that can be scary. And there's also a lot of misinformation out there. There's people that are trying to put, sensational stories out there, or people trying to sell things to folks that may be dealing with, serious illness. So it's hard to know how to sort out, the good from the bad, and I'm going to give you some tips about that today. So what is this health literacy stuff? There's a definition that was created some years back in the early 2000s, actually, to support Healthy People 2010. And it is, as you see on the screen there, the definition is the degree to which people have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So, of course, anymore, the obtaining part isn't much of an issue. We have access to information like never before. But the more important kind of building blocks of this concept is the processing and the understanding of the information so that people can be equipped to make better healthcare decisions. And really, now there's emphasis on people being partners with their healthcare professionals in their own care. And we're going to talk about that in a few more minutes. There's another definition that I like from the New York City Mayor's office. They had a health literacy initiative some years ago, and the first half of it looks very much like what we just saw. It's the ability of people to read, which is a piece of health literacy, understand and act upon health-related information. But they have a second part of their definition that also speaks to the capacity of professionals and health institutions to communicate effectively so that community members can make informed decisions, take appropriate actions to protect and promote their health. And I like this definition because the first one in some ways kind of blames the person for not being health literate. It puts all the burden on the individual to know what to do. And in this one, it's clear that it's a two-sided issue, that healthcare institutions and professionals need to have the capacity to communicate effectively with their constituents so that it goes both ways. It does need to be a two-way communication. And there's more and more regulation about that in the pipeline. Health literacy is important because if somebody has poor health literacy, it's a predictor of a person's health and health outcomes. And it cross-cuts any of these other, kind of socioeconomic indicators. And, the way I sort of describe this is, somebody can be well-employed and well-educated, but can be as overwhelmed as the next person by being in the healthcare system. And, it's scary to be sitting on that exam table in a paper gown and have somebody talking to you about your health. And I'm a big proponent for people even having an advocate with them, especially if they know they're facing a new diagnosis or a chronic or serious disease, because you just don't process well under those circumstances, and it's important to really be in a position to best take in that kind of information. Also, people with low or inadequate health literacy, just in general, have less health-related knowledge, may not know their own anatomy or the words to articulate what's going on. Folks with lower health literacy tend to receive less preventive care, so are less likely to have screenings like mammograms, prostate tests, those kinds of things. Tend to have poor control of chronic illnesses like diabetes and heart disease, and are hospitalized more frequently. Health literacy isn't just about reading. It also affects people's ability to just navigate their way through the healthcare system. As we know, those of us who have had to use the healthcare system, it has, again, its own language and its own rules about how to work your way through and get from one place to another, even within a clinic or a hospital. It affects people's ability to share personal information, to engage in self-care and chronic disease management. There's numeracy literacy involved here. People need to understand things like probability and risk. What happens if I don't take this medicine or choose not to have the test that is being recommended? I need to understand those kinds of concepts as well. There's been a movement in the last more recent years really focusing on health literacy, and this just goes back to 2010, but even before that, the Institute of Medicine produced a big report called something about ending the confusion about health literacy. But of course, the Affordable Care Act was enacted, and there's verbiage in there about communication with patients and engaging patients, meaningful use, and we'll talk about that in a minute. There was a national action plan to improve health literacy that was implemented back in May of 2010. Healthy People 2020 was put into place back in 2010. So every 10 years, these Healthy People frameworks are put out, and it steers the directions of public health and areas of emphasis for health education for the general public. So you've probably heard a lot in recent years about childhood obesity, for example. That's one of the big pieces of Healthy People 2020 is trying to reduce childhood obesity. So there's a driver behind some of these big kind of initiatives that you hear about in the news and elsewhere. Then back in 2011, there was a national prevention strategy put into place that also addresses health literacy. And as recently as November of last year, there was a toolkit put together by AHRQ, the Agency for Health Research and Quality, called Health Literacy Universal Precautions Toolkits for primary care providers. And it's a framework that they can use in their institutions to make sure that they are working in a health literate institution. So it speaks back to that second definition that we talked about making sure that not just patients or people interacting with the healthcare system are health literate, but that the institution itself is. And so there's this Universal Precautions Toolkit that's available for use for clinicians. So what does this mean for us as information professionals, and how can we help people, kind of grow their confidence and become more health literate? For one thing, it's important for us to know kind of what's going on out there in terms of trends and issues that people are engaging in when they're seeking health information. We can help guide people to known quality health information as opposed to having folks, just Google out there and see what they get and hope for the best. We can also teach people how to look at web-based health information with a critical eye, and as I mentioned, I'll give you some tips about that. It's pretty common sense, but it never hurts just to be refreshed and reminded about those concepts. And then also help people feel empowered a little more to then go and have an interaction with a healthcare provider and know where they can go for more information and help. So just talking a little bit about some health information trends, and these I reviewed these not too long ago, and they're still pretty current, these statistics. So about 80% of American internet users are looking online for health information, and that number's remained stable for, about 10 years. And, I've heard a statistic quoted that searching for health information is the third most popular activity online after email and shopping. And, that's because we all live in one of these, bodies that we're walking around in and have to take care of it. And either we are concerned for our own health or the health of a family member or a loved one. So it's a big, universal topic for everyone and a lot of people. When searching for health information, most people do start at a general search engine like Google. And only 15% of the people doing that say they always check the source and date of the health information they are finding, and another 10% say they do so most of the time. So only 25% of people who are searching for health information are looking for quality indicators of the websites that they find. So that's where we can come in as information professionals and help people out a little bit and guide them along. So this other statistic says that about, let's just say 60% of American adults sought information about a personal health concern from a source other than their doctor. So again, people are searching and don't necessarily want to interact with the healthcare system as their first line of attack when they're looking for health information. But those who do actively research health concerns have positive outcomes. More than half say that it helped change their overall approach to maintaining their health, and 4 in 5 said that it helped them to better understand how to treat an illness or condition. So right there is some indicators of improved health literacy and improved capacity to self-manage health. I mentioned the Affordable Care Act a couple minutes ago, and there's rules written into that act for healthcare systems about patient education in particular. And so meaningful use means that these clinics have to show that they are using their electronic health records in a meaningful way when they have encounters with patients, and that includes offering patient education at the point of care. And so it's important for these health records to have a capacity to provide that kind of information. And there's lots of iterations of that. One is provided by the National Library of Medicine called MedlinePlus Connect. So it's a way to link out to health information from MedlinePlus from an electronic health record. But there's lots of other resources out there. But as time marches on, if you're interacting with your healthcare provider and have new information provided to you, they're being mandated to educate you on the spot and write out or hand you some information to take home. A lot of health systems are going to providing personal health records. I see a doctor in the Franciscan health system, and now I can access my chart. I can go in and look at my lab results, and that kind of thing, and that's becoming more and more commonplace. And there's also a big movement for people to become what are called e-patients, which means people are online out in the digital world and interacting with each other in forums. There is even a whole field called participatory medicine, where patients are participating and advocating strongly for themselves or their loved one within the healthcare system. There's a gentleman named Dave DeBronkert, who's known as ePatient Dave. He has a blog, and he has done a lot of public speaking about the importance of being a strong self-advocate in the healthcare system. So these are big trends that we're seeing now as far as consumer and patient behavior. So now that we have a little bit of background about some of these trends, I just kind of want to remind folks about, why should I go to the internet for health information at all? Well, to begin with, websites are much easier to update than print materials. And with health information, currency is very important because new research is being done all the time. You're going to hear things almost on a daily basis about new, treatments for things or adverse effects of things, and you want to know that your clinician is really keeping current with treatment options for different things. Computers are available for people to use at libraries, of course, and other community centers. And of course, medical, the STEM parts of collection, science, technology, engineering, and medicine titles are some of the most expensive ones to purchase for libraries and for individuals. And so, it's a very expensive part of a library collection to replace and keep up to date. So, the websites are just much easier to update and keep current. I always put a little caveat on this, though, and remind people, of course, that online health information is never meant to replace medical advice from a health professional. It's just meant to equip people to have more informed interactions with healthcare professionals and just answer, maybe some basic questions before approaching somebody for a consultation. Okay, so where do we start? And maybe Gina and Lindsay, do you want to type into the chat box if you've used MedlinePlus.gov before or have seen it before? Okay, Lindsay has used it. Good. So I just have a series of screen captures. I'm not going to Great, thanks, Gina. I'm not going to go into a super in-depth demonstration, but I just kind of want to, that's great, thanks, Jeremy. I just want to kind of refresh your memory a little bit about this site and what it does, and I may be able to show you a couple features that you may not have been familiar with. There's kind of some hidden gems on here that people don't always know about. So this is the front page of MedlinePlus.gov. This is the National Library of Medicine's Consumer Health portal site. It was rolled out back in 1998. It's been quite a few years already, 16 years. And it was created because in 1997 was when PubMed was created, which is the interface to search the more technical medical literature. Oh, great, thanks, Gina. She hands out Medline Plus bookmarks to patrons. If you need some more of those, let me know because we can ship them to you. So anyway, that's another service we provide from our office, by the way. The National Library of Medicine discovered that about 30% of people who were using PubMed when it was first created were members of the general public. And PubMed, if you've used it at all to look at the journal literature, is a very complex resource, and it's not very user-friendly for members of the general public. So the National Library of Medicine responded very quickly, and of course the internet back in the late 90s was kind of a new boondoggle too, so they jumped on the train and created this more consumer-friendly website, and it's evolved over the years into what we're now seeing before you. So again, this is the home page. That graphic piece, that banner at the top kind of rotates some images, mostly just for graphical interest, and those topics change with the season and with trends. But really what I call the meat and potatoes of the website are those three green tabs through the middle there under that banner. Then to the right, there's some health news stories. Those are updated every day. And then some commonly searched health topics in the center box, and then you can see there's a series of tabs there that you can use to look at more specialized information for seniors, men, women, or children. And then the bottom of the screen looks like this. There's a little word cloud there, and those are terms that have been typed into the search box, and you've seen these clouds before. You probably know the bigger the word, the more common it's being used. So you can kind of see trends in health information and what topics are hot right now. So you can see fibromyalgia and anemia and asthma. Asthma is always up there on the list. Are some that have been commonly searched. And then in the center, there's links out to the senior health website, which we'll look at shortly. And there's another tab there for clinical trials, which is a database that shows clinical trials that are recruiting patients, but also has some results of research studies in there. And we will not be looking at that today. But some of the hidden gems I like to mention, over to the right, you see three purple buttons. One is to the MedlinePlus magazine, which is a quarterly publication that comes out. It's a lot like the WebMD magazine with no ads because it's produced by the federal government. You also see a button there that says easy to read. So if you were to click on that, you'd see an alphabetical list of health topics that are all designated easy to read. And of course, one of the issues with medical information is it's a high reading level because of the medical terminology. So usually at about 12th to 15th grade reading level, and of course our general public reads at the 6th to 8th grade reading level. So it's a challenge to have folks looking at medical information. So it's nice to have some pre-sorted information that's considered easier to read. And on each health topic page, links will be labeled as easy to read as well. And the other button that you see there says multiple languages, and later in the presentation I'll show you what shows up when you click on that, because I know there's a lot of immigrant and refugee populations, especially here in Western Washington, and you may have folks that are looking for other languages. I will go back one click and show the home page again and point out the orange Espanol button just under the MedlinePlus logo. You can click on that and toggle over, and almost the whole website is also available in Spanish, since that's the most commonly spoken language in the United States after English. So the other little gems I like to point out, and I'm not going to show these in any detail, but just to remind you that they're here. They're kind of tucked away down here at the bottom of the front page. There's a link to directories, which is find a whatever, find an orthodontist, find a hospital, find a dermatologist. Those are nice to know that they're there. There's also a link to organizations. So these are like national health-related organizations, like the Alzheimer's Association or the Stroke, Association, or you name it. And what's nice about those is they're very dedicated to their particular topic. And a lot of them may have local chapters that you could refer people to if they're looking for a support group or just more local contacts about their area of concern. And then there is a link to a full-text medical encyclopedia as well. And so that link is there at the bottom of the home page. So I've clicked on the Health Topics tab and then clicked on the letter A and scrolled down to a topic of, I mentioned asthma is always common. So here's what a health topic page looks like. This one is asthma in children. And every health topic page has that blue box up at the top, which is just a general summary of the topic itself. And then as you navigate around on the page, you'll see links out to other information. You see here there's a link to the medical encyclopedia. And if we look at the bottom part of this page, there's a table of contents portion there on the left-hand side that's broken down. So if I just want to know about current treatment for asthma in children, I could click on that treatment link and just jump down to that part of this page without having to scroll all the way through. There's also information in other languages linked here on the right-hand side if it's available. Not every health topic has information available in other languages other than Spanish. And it just depends on the richness of the topic and how common the issue is. So I cannot promise that every health topic is going to have a choice of languages for information, but just to let you know, if there is something available, it will be linked there on the right-hand side. There's also full-text information on MedlinePlus about over-the-counter and prescription drugs and herbal supplements. So if you click on the first letter of the name of a drug, either a generic or a brand name, you'll end up looking at a page with information about the drug, what it's used for, what its side effects are, how to store it, what if I forget a dose. If there's any kind of a warning about drugs, it will show up in a red box at the top of the results page. There are some drugs that do have adverse interactions with certain things. There's also some, that you shouldn't just stop taking. You need to kind of wean yourself off of them slowly, and there would be information like that. And then there's also, as I say, information about herbs and supplements. Those are becoming more and more popular for people to be taking, so you can look up information about those. And the difference between the information sources here is that the herbs and supplements database that's being used does talk about the effectiveness of herbs and supplements for different claims based on some evidence-based research that's been done. That type of information is not available for the drugs, and that's mostly because drugs and supplements are regulated differently. There's a much more stringent process that drugs have to go through to get approved by the Food and Drug Administration. Supplements are regulated more like food, so it's interesting that it's different. There's also a section of the website called Videos and Cool Tools, that third button in the series of 3, and this is what you'll see after you click on that button. And here you see there's several different choices. It's kind of alarming that there's a gun there. That just happens to be what the news story was yesterday. There's a little video about, you know, current things that are in the news. But you see to the right of that, there's a link that says interactive tutorials. There's another one that says anatomy videos, and a third one that says surgery videos. And those tutorials are like little slideshows with kind of cartoony looking illustrations, and there's a narration that goes over it. And those are all considered, you know, quote unquote easy to read. The language is simpler. You get small slices of information at a time. Every so often a yes, no, true, false type question will pop up. And there's quite a selection of those for people to watch, and many of those are also available in Spanish. The anatomy videos are very helpful. They're usually about 1 to 2 minutes long. It shows an animation of what happens when you swallow, or what happens when you breathe, or how your blood circulation works, and that kind of thing. And then the surgery videos are they are lifelike. They've actually gone into operating rooms, and with the permission of the patient, videotaped a surgery, or if it's a laparoscopic type surgery, they'll have a camera inside the patient showing what's going on during a surgery. So you have to kind of brace yourself for the first couple minutes, but once you get into those, they're very good and very interesting. They're all about an hour long, and they really are a great way to get information about what to expect if somebody is expecting a surgery. I had a procedure a few years ago and watched the video of the procedure that I was going to have, and it really did answer a lot of my questions, and people are emailing into the surgeries with questions that anybody might want to ask. You know, how much blood am I going to lose? When can I drive again? Am I going to have restrictions on how much weight I can carry? You know, that kind of thing. And then over on the far right side of this, you'll see there's a link to calculators and quizzes. So it's, you know, you see there's calculate your body mass index, or how much folic acid should I take, or how much do I know about glaucoma. You can really quiz yourself about just about anything. And then there's a link there for interactive games for, you know, young teenagers and kids. So that's the videos and cool tools section. And then I mentioned that tutorial about understanding medical words, and there is a link to that right here from this page if you want to explore that. So a couple other features of MedlinePlus I want to mention. One, if you click on the About MedlinePlus link under the logo there, you'll find some interesting information. There's some information for trainers. So if you want to demonstrate MedlinePlus to your users at your libraries and hold a class, there's information there about that. There's also a link to a resource called A Guide to Healthy Web Surfing, and it's going to be something that you could print out as a handout for your patrons about some of the concepts we're going to talk about in a few minutes about how to look at health websites a little more critically. There's the orange Espanol button again that I mentioned earlier. I just want to remind you about that, and that's linked from every page on MedlinePlus. So if you get to a health topic and you just want to toggle over to Spanish and print it off for somebody, you can. And then I just want to point out the search box as well. Not every topic is one that you can just drill down to through the alphabet, but if you just are really wanting to find information about a topic and you're not finding it by browsing, you can search in the search box, and it's searching across all of the website for links. So, and it does have a suggested spelling correction type feature. So if you're not quite sure how to spell a medical term, it will try to help you out. But there is also the medical dictionary linked from the home page there too that you can try for alternate spellings. And I mentioned at the beginning of the demonstration that I was going to show you what would happen if you click on this purple multiple languages button. And this is the page you'll get, and there's quite a list of languages here, and if you click on one of those, you'll see an alphabetic list of health topics that are available in that particular language. As I say, some are more extensive than others. I've been working a lot in the Somali community here in King County in particular, and there's quite a bit of information in Somali. So if you have different ethnic groups that you're serving in your communities, you might want to explore this. And often what you'll find is a PDF document, one page English, one page in the other language, so that you can be assured of what you're handing them even though you don't speak the language. So it's just good to know that that's there for you. So I just want to move along for a couple minutes to the Senior Health website, which we saw is linked from the homepage of MedlinePlus, but you can also just get to it by typing in NIHseniorhealth.gov. This is a partnership between the National Library of Medicine and the National Institute on Aging, which is one of those many NIH institutes there in Bethesda. And it's just narrower in focus than MedlinePlus. It doesn't go as deep in terms of the number of health topics, and the information is organized a little bit differently, smaller chunks of information. There's also some accessibility features built into the website right under the banner where people can just click the button and make the text bigger. They can also change the contrast of this, where it will have what you see kind of behind the screen capture. It will be a black screen with yellow text, because there's been research done about people in particular with macular degeneration, which is an eye condition, and they have a hard time looking at a white screen with black text. It's too bright. So the high contrast feature gives some relief for people with that issue. But you'll see there's an alphabetic list of health topics, so if you know the first letter of a health topic, you can just click on that first letter and drill down, or you can look at health information by category or click on the all topics and see the full A to Z list. But I wanted to look up information about osteoporosis, so I just clicked on the O and went to osteoporosis, and this is the first page of what you would find. So you see it's not a list of links like what we saw in MedlinePlus. It's kind of more pre-digested information. There's often little short videos linked from these health topics, which is nice. Over on the left-hand side, you see kind of a table of contents. So if I just want to know, as I mentioned about the asthma, if I just want to know about treatment for osteoporosis, I can jump right to that section and click on that link, and away I go. And there are, as I say, several videos, and there's also a way to quiz yourself about a topic. So I clicked on that link and got this question about, after I've read the information, I could go in and test my knowledge by taking a quiz question here. The bottom of the home page of Senior Health has some other features that are of interest. In particular, there's a whole list of the health videos that are scattered throughout the site, but they're all listed here. I will say the breast cancer videos linked from the site are excellent. So if you're wanting some high-quality videos for people to watch, there's quite a little series of them here about breast cancer that are really good. And the other thing I want to point out is this trainer's toolkit. So again, if you want to schedule a session where you're training people, this toolkit is for both MedlinePlus and the Senior Health website, and it's out-of-the-box curriculum. There's beautiful PDF documents that you can print off. There's worksheets for hands-on activities in a computer lab, and it's basically like a cookbook. It really does walk you through training a group of people about how to use the web. And it even has computer basics to begin with. So if you're dealing with audiences that are, not as computer comfortable and don't know what a URL is and don't know what a scroll bar is, there's some great curriculum that you can use right here, linked from the Senior Health page. You'd never guess, but it is really good stuff. So I would encourage you to take a look at that. So I promised you one other resource, because I'll never say that MedlinePlus is the only health-related website that people should look at. I think it's a great starting place. It's quite rich with information, but it's not everything. So this page is from the Medical Library Association. It's my professional organization that I belong to. And CAPHIS, the C-A-P-H-I-S, is the Consumer and Patient Health Information section of the Medical Library Association. And one of our members just updated this list last September. So they have gone through and looked at health-related websites under all these different categories and annotated them all and provide them here for you. And if you look under the link of those categories, there's a link that says PDF of complete top 100 lists. So that's something you could print out and have at your reference desks if you'd like. So this is just a really great resource to be familiar with for other health-related websites that you can trust, because they've already been vetted and annotated by medical librarians that have done the work for you. So we're going to shift gears just for the last few minutes here, just because we talked about the processing of health information as being part of health literacy, because now we've accessed it, we've gotten at it, we've gone into MedlinePlus or Senior Health or one of those top 100 websites. So getting to the information isn't the problem. It's like, now what do I do with it? So these are some examples of questions that people could ask about health topics. What is, I don't know, myeloma? Who's at risk? Am I at risk? What causes it? What can I do to prevent it? What are the treatments? What are the symptoms? How are you diagnosing this? What are you looking for by drawing my blood? That kind of thing. What's the latest research? So these are, the types of questions people could ask. And then for those who we know are still going to go out and Google for health information, we want to equip them with some ways to evaluate those websites they find for quality. And as I mentioned, there's that link from the About MedlinePlus section called The Guide to Healthy Web Surfing, which is going to have very similar information to what we're looking at here. So the types of questions, again, pretty common sense. Who's sponsoring the website? Why is it up in the first place? Is it a .com? Is it a .edu? Is it a .org? There's a lot of information that you can find, of course, under the About Us section. Can I reach the sponsor of the website? Is there a way to contact them? Do they have an address or a phone number? Those are indicators. Who wrote the information? Is there an author listed or a sponsoring agency that's reputable? You kind of want to be aware of personal stories. I think they have their place. I think there's a place for support online for people who are dealing with chronic and serious illness. But in terms of kind of the first way of exploring a health topic, you may not want to start with that. You also want to know if the information is being reviewed by a panel of experts, and that should be revealed in the About Us section for most health websites. We mentioned at the beginning, you want to look for currency. You want to see when things were written or updated. You also want to make sure your privacy is protected. You should look for a privacy statement. You don't want to go to a website that's asking for personal information, certainly not Social Security number. I think most websites don't do that anymore, but always put that out there as a caveat. You kind of want to be wary, of course, of sites that make claims that seem too good to be true. Breakthrough, miracle cures, those kinds of things. You might want to compare a website to a couple others and make sure it's providing similar information to others about the same topic, or if it's an outlier. And also just be a little careful of lists of links because, there's not necessarily endorsement implied, although here I am showing MedlinePlus, but it's sponsored by a very reputable agency, which is one of the indicators you want to look for. So to kind of get to the home stretch here, we have access to good health information. I vetted it for quality. I know it's good information, so now what? Now I want to know how to better communicate with my healthcare provider. And one website I really like for this is called Ask Me 3. It's hosted by the National Patient Safety Foundation. And it basically focuses on these 3 different questions that you could be armed with when you go to your health professional. One is, what is my main problem? What do I need to do, and why is it important for me to do this? And there's a portion of this website that's also geared toward the healthcare professional in terms of equipping them to feel more comfortable interacting with their patients about these types of things. The National Institute on Aging also has a publication called Talking with Your Doctor, but I don't feel that this booklet is restricted to older folk. I think it's appropriate for just about anybody who's preparing to go in and have an interaction with a healthcare professional. It used to be that you could order up to 25 copies of this as a booklet pre-published, but that option has left the building, but it is available online as a PDF, and you can either print it off as a PDF or just look at it online. It's also available in HTML just as a web page, so it's another nice resource to be familiar with. And it's got nice graphics and white space. It's not just a block of text for people to look at. And if you need more support or want to know where to turn for more help, we are a network of member libraries here at the National Network of Libraries of Medicine, and we have a membership directory linked from our website. And so you can go in and search for other medical librarians in your area. You could also link from MedlinePlus. There's a directory of libraries. These are people that have self-selected as locations that provide consumer health information, and it's linked from that directories link that I pointed out to you at the bottom of the home page from MedlinePlus. And when you click on that, you'll see, find a library, and then you'll see a map of the United States, and you click on Washington, and you'll see a list of libraries in Washington that are offering information service about consumer health topics. So I always want to encourage you to tap into the network of medical libraries that are out there. Our office also hosts a list called HLIB, H-L-I-B, Northwest, and it's available to anybody who wants to subscribe to that, and it gives you access to medical librarians throughout the Pacific Northwest. If you just get a stumper, you can post a question, and every so often people put out requests for an article or a book chapter, that kind of thing as well, if you've got kind of one that's a toughie. And just like all librarians, people are happy to help and provide support. So I will leave these last 5 minutes open for you folks. If you have any questions for me, I'm happy to take them. Is there a health topic that's been particularly difficult? Okay. All right. You're very welcome. And I'm available by email anytime. I'll type my email into the chat box. How's that? And thank you for attending.
Thank you so much, Gail.